welcome to another installment of Ortho Real Podcast. We're on sort of a field trip today, checking out something a little bit different, a little bit out of our normal wheelhouse. We are at Greenbridge with Alan Sirmon. Alan, welcome.
Thank you for having me.
Tell us what you do.
So we're here in Daphne, Alabama. Greenbridge is the name of the company, and we produce vape products and CBD products.
So I've had this is a new space for a lot of us. I mean, I think there are people that are very enthused about, quite frankly, about marijuana, but then about CBD and other options like that, and their potential for therapies, for treating health conditions, for all sorts of things. I've had a little background on this, but it certainly diverges a lot from what I was trained in. But tell me a little bit about, I guess, first, marijuana versus hemp.
That's typically the big question there, and the best way to describe it is how the government defines it, the federal government. And the federal government defines the difference between hemp and marijuana by how much THC is in the final product. And under 0.3% total THC is considered a hemp plant, and anything over 0.3% total THC is classified as a marijuana plant.
They look pretty similar.
They're the same plant.
So if I saw two of them side by side,
you would not tell the difference.
It's strictly by testing the end leaf flower product.
Correct.
That you would know the difference between the two.
Yep, and that's part of the regulations dealing with the hemp plant is that it's heavily tested through the growth period, and before you can harvest, you have to do a final testing where they send the plant off for COA, and they give you the thumbs up or thumbs down on whether or not you can harvest it. If it tests above the legal limit, they will give you a destruction notice, and they'll come out and destroy your crop.
Interesting. So THC, that's the part that produces a high, right? That's the recreational marijuana drug portion.
Whenever you think of THC, you're typically thinking of Delta-9 THC, and that is what's the predominant THC that's in cannabis or in marijuana, but there's actually a lot of other THCs available naturally in the hemp plant.
So how many are there?
I think it's really unknown at the moment, but typically the other THCs are in very, very small amounts. So there's D8, Delta-8, Delta-10, there's THCO, THCP, THCV, which THCV is very, very interesting, a cannabinoid. But outside of that, I mean, the list kind of grows every day. But again, those cannabinoids are very, very limited in the plant.
Okay, so they're present in very small amounts. And so what you're working with then is CBD, yes?
Correct, yeah. We do CBD, we do CBG, CBN, which are all other cannabinoids within the plant. And then we also play with some of the legal THCs that come from the hemp markets. And again, like I was saying, those other THCs are very have small amounts within the hemp plant, and as long as the final product comes from the hemp plant under the federal guidelines, under the farm bill, they're legal to sell.
So, and cannabinoids and an endocannabinoid system or endocannabinoid system. I don't know that I'm even getting the terminology right. There's a lot of new words here. And I know a lot of this is unknown. What do we know about that these things actually do in the body?
Well, I think it's the endocannabinoid system is just now getting to be studied properly. And humans have an endocannabinoid system. That's a fact. And your body actually produces its own cannabinoids. And it just so turns out that marijuana or cannabis in general produces these cannabinoids that are almost identical. And I think you could even make the argument that humans have evolved with cannabis so closely that they're almost made for each other.
So, and when we say that you have an endocannabinoid system. It's not like your circulatory system or your digestive system. What we're talking about are receptor types on cells really throughout your body.
Yeah, specifically, you're talking about the C1, C2 receptors, and both of those have different functions. I might have to look at notes for a minute, but typically the C1 is more for like regulates stress, anxiety, temperature, stuff like that, and then the C2 receptor uh, regulates the immune system.
Okay. Well, and to some degree, and to your point, there's probably a relative paucity of information about what a lot of these things do, just because historically things get studied that we can intervene with, and pharma studies things and provides research and grants for things that they're going to be treating and trying to optimize, and that hadn't really existed in this space.
Yeah, it's been illegal for a long time, so it's hard to get the approval to study these plants whenever during the prohibition. So all that stuff's starting to open up again, and research is really taking off.
So from the sidelines here, because there's part of this that seems like the wild, wild west, where there's some of these industries that are growing up from something that was illegal. There's obviously, on the marijuana side, there's parts that in certain places still are illegal. Where does this evolve from here for companies like yours? What are you going to be providing? Are we going to see other supplements that are medically directed? And then what's pharma going to do?
That's a big question.
Agreed. There were a lot of questions in there. I'm just staring blankly because I don't understand most of this stuff, and I'm trying to get my head around it still.
Yeah, well, the the pharmaceutical industry is certainly interested in this, and I think rightfully so. And I don't think that the research is fully there yet. There's a lot of research that had already been done on a lot of these minor things. But as more research comes out, I think that the CBD, the cannabinoid markets are going to explode, because the way that this plant almost perfectly attaches within our system, the upbeat benefits from it are really undetermined right now. It's almost like every day something else comes out with it. And the negative effects from this are so minuscule. And I don't want to say they're not there, because there are some negative effects, but they're so limited that I think there's really only upside to this.
I've heard similar things expressed from other places, and to your point, there's nothing that's free of side effects or free of potential issues, but it's sort of looking for overall safety with these things. And I think that some of the things I've heard proposed are certainly for sleep, anxiety, and maybe of interest for me in the orthopedic space is reducing pain, but also reducing opioid consumption in the context of patients that have pain.
Absolutely. There's been a couple of hospitals that have done some research on this, and they've determined that combining CBD with opioids can reduce the amount of opioid use, and if that's not a good thing, I don't know what it is. And because of that, you could also reduce people getting addicted to those if you're reducing the amounts that you're giving them. So it's almost like on every front there's kind of something to be had from the cannabis industry.
And so we've talked about that on the podcast, certainly with Scott Sigmund, the original opioid-sparing orthopedic surgeon, about the dangers of narcotics and opioid abuse, and things to do to try to reduce that. And this should come with the caveat that while I am a doctor, I'm not your doctor or the doctor of anyone listening to this, and this is not medical advice, but for a patient that's interested in CBD for knee arthritis. I mean, pick a condition, or they have some mild to moderate pain, or they have trouble sleeping, or maybe they're being treated for that. What do they look for? How do they explore this?
I think the most important thing is finding a reputable company, and as you mentioned before, this industry is still very new, and a lot of people attach the word Wild West to it. But there are some things to look for. You're looking for a company that is very open with their COAs. Whenever you're looking for a product, typically on the back they'll have a QR code that you can scan with your phone, and it'll pull up the COA for you to see, and then within the COA, you're wanting to look at whether or not they've done a full panel or not. A full panel gives you everything. It tells you if there's pesticides. It tells you if there's residuals. It tells you everything you need to know about that plant. And whenever you're looking at any of these cannabinoids, the the one thing in there that could hurt you in there is going to be the pesticides or the residuals left over in the process. And I think the majority of the industry has switched over to this, and I think it's a great thing. I think being open with your product and letting people, educating the consumer so they know what they're getting is the right way for this industry to grow.
I've heard unsubstantiated reports that a lot of commonly available products in the CBD space, even on the shelves at Walmart or CVS or wherever, that it's not uncommon for there to be THC in these as well.
Correct, and I think this comes full circle back to educating the consumer, and within the hemp market or the CBD, all these other cannabinoids, there's different levels of plants, and the easiest way to describe it, and how an analogy that I heard that I think makes the most sense, is if you take orange juice and you squeeze the orange juice, that is the closest thing to that orange that you have. And if you want to put that on par with the hemp industry, that was what you would call full spectrum. And what that means is that it has all the cannabinoids in it, it has some THC in it, and it has all the terpenes in it. And then the next step in the process would be removing the pulp. So you'd have pulp-free orange juice. The pulp represents the THC, and that would be called broad spectrum. That broad spectrum is very, very close to having zero THC in it. There might be very, very small amounts in it, but I don't think enough to really pick up on any testing or anything like that. And then the next step would be your frozen concentrate orange juice, and that's what you would consider an isolate. And so isolate is you're isolating whatever cannabinoid that you're after. So in this case, you're isolating CBD. Therefore, it would be a 99.9%, 999% pure product. And so depending on what you're wanting, if you want legal amounts of THC in your system, and there's still benefits for that as well, but if you're someone that can't have a THC in your system for whatever, for work or for personal reasons or whatever it is that you're needing, then you might want to stay away from full spectrum products and only look at broad spectrum and isolate products.
How are most of these being dosed for patients using this? Is this, oral, liquids, gummies, vapes? What do people do?
A huge broad spectrum. So people are using it in vape juices. They're using it in vape products. They're using it in edibles, whether it's gummies, a huge list of it. You can get it in tinctures. You can get it on roll-ons. You can get it on basically anything that you can imagine. It's there. But just to keep it simple, I mean, you're either gonna smoke it, you're gonna eat it, or you're gonna put it on your skin.
The big question again: is there a lot of difference in how you take it in terms of the effect?
Yeah, and your body doesn't process it the same. Typically, smoking the product is the highest dose that the most amount that your body would absorb, and then kind of running up to that, you can kind of split the edible market into like tinctures or gummies, and then gummies probably come in. Let's say so you have smoking. Then you would have your what's the name of the where you put it under the tongue? Sublingual, and then you would have your edibles because your stomach would have to process it, and then fourth, I would say it would be whatever it is, lotions or tinctures,
transdermals.
Transdermals, yeah.
Okay. Wow, a lot to take in. So Greenbridge, what are y'all doing, and where are y'all headed as this continues to evolve, as people continue to explore this area more?
Well, we started out in the vape space, and we saw an opportunity within the hemp market, and within that market, we think that it's still very, very new, and it's very, very young, and our market research shows that 90% of people out there that want to participate in this really don't want THC at all within these products, and it. And because of that, I think the educational piece needs to be added into what we're doing, and there's still a lot of concern out there with people misconstruing what hemp is versus what marijuana is.
So that's interesting that you said that a lot of the consumer demand, 90+%, does not want THC. Is that just evolving in a separate channel for people that want recreational marijuana and recreational THC in other forms? And these are separate from people that are looking for relief from orthopedic problems, sleep problems, anxiety, skin problems, things like that?
Well, I actually think that all these people are wrapped up in the same category, and I think a lot of people use THC for the same reasons they would use CBD, and it really depends what the end user wants from their experience from the product as well, and as of right now, the majority of the market is really dominated by these THC cannabinoids that come from the hemp market, and I think as this market grows, you'll see that other 90%, as they learn about this product, really start moving back into the space, and they're wanting the health benefits from this without the high.
Interesting. So tell me about zero THC products and what is CBG?
Yeah, so CBG is the mother cannabinoid of all the other cannabinoids that are out there. And when you look at the industry as a whole, the big players in the industry, the beauty products, the companies that are making all the lotions, the companies that are making the food products, they can't enter this space because the FDA will crack down on them. Their banks will crack down on them. Their investors will crack down on them. So what this product really allows is for these other companies to start dabbling, getting into this space, and putting their resources into it, and for research and for product research, and honestly, I think there's with CBG alone, it opens up a whole other avenue of benefits that come from it, and I think one of the biggest applications is going to be for dermatology. CBG, I don't want to make any claims or anything like that, but the research shows that it can really help with a lot of skin conditions, and a lot of inflammatory responses.
I am interested in it. See where it evolves, and anecdotally, and of course, this guy was trying to pitch me on his CBD products that he's got. This Corganics. I mean, they're medical. Well, they're CBD products, but they want to distribute through healthcare providers only. So they're trying to go down that road with it. And he was telling me about his mom and her knee replacement and what she was using gummy-wise afterwards, and very limited exposure to narcotics. And, I mean, it is interesting, and it's got a lot of potential.
Mm-hmm. Yep, and, anecdotally, my mom also just had knee surgery, and opioids are a scary thing, and you never know what can happen with those. And so
we do know what can happen. I mean, when we got data for that. So that's the whole reason that stuff like this gets interesting. It's that 6, 13, and 30, and that if we give somebody a month prescription for opioids, there is a 30% chance that they will still be taking them a year later. The addiction potential is huge, and as an orthopedic surgeon, and I've been a party to this, not as much as anybody, but certainly as much as some. I mean, we all try not to, but we have to realistically look at this and know that what we do can sometimes be a gateway to addiction for people. And so I think it's incumbent on us to start looking for some of these alternatives of what can we do to reduce that usage and to still help people.
That is an incredibly high number, 30%?
30% with a 1-month prescription.
Wow.
So even at a week's prescription, it's around 13%. That's the potential that they will still be taking narcotics 1 year later.
Kind of moving a little bit away from the hemp space, kind of where we're at here in Alabama with medical marijuana coming in. That's one thing. I think they've done a pretty great job with kind of opening the doors. It seems over the last week they kind of added some more conditions to it. They kind of dropped some regulatory issues with it. But I'd really would like to see cannabis being used in front of opioids. And the way the current law is written is you still have to, for pain management, you still have to use opioids before being prescribed.
I had seen that in the drafts of some of the potential legislation for this.
I hope that gets changed.
That's insane. Let's have you try something really, really dangerous before we have you try this other thing that, admittedly, still needs research and still needs more data, but there's a long history of experience, and it just is not as dangerous.
Well, I think the sample pool for cannabis in general is massive, and I mean it's been used for a very, very long time, and I think if you wanted the sample pool to go do the research, as far as I'm concerned, is there already. We know the maybe not all the effects of it, but we know the dangers of it.
Yeah, well, and it certainly for every illicit drug, I mean, every ER doc in the country knows the effects of those and what goes on with those, and every physician that's ever been trained has seen somebody withdrawing from alcohol or from narcotics or from these other things, and where is that for marijuana? It doesn't exist.
And that's absolutely right. I mean, it's there. I can't say that I know enough on the research on the addiction side, if there is any, and maybe you could speak to that some. But from my worldview, I've never seen that.
Well, I think to your point, the sample size is huge because although it's illegal most places, I think we can all acknowledge that there are a fair amount of people in the United States that have and do use marijuana, and we're just not seeing a lot of those issues.
A lot more people than I think people even realize.
For sure. Alan, thanks so much. It's been enlightening. I feel like I'm going to be back. I feel like this is a space that is very rapidly evolving, and nobody really knows which direction it's going to go in, but I think it's got a lot of potential applications. So if anybody needs to reach you or hook up with Greenbridge, how do they do that?
If you'd like to reach us, you can contact us on our website at greenbridgeusa.com.
Thanks so much for coming on.
Thank you for having me.